Okay, welcome back, everyone. Good evening and good morning, some of you, those who already joined. In today's class, we are going to continue the previous session. So the previous class, which we were doing on the prioritization, and that was a master class on that day. So today we are going to try our best to finish all the rest of the questions. Hopefully we can make it today in a one go. But yeah, as most of you already know, I always make this announcement ahead of time. So just in case if I leave the room for a few minutes, I'll come back and I'll let you know when I leave the room as well. Because sometime I need to go and come back again and again just to see my little one. So in case I leave the room, just try your best to understand me. Right now, we are live on both sides on YouTube and also we are live on the Zoom at the same time. Okay. So we left until this question. I remember the last question we discussed was this one, right? So this was supposed to be the next question here today. Try your best to participate always at the same time. The more you participate, the more you can understand. So let's read this question together, everyone. Prioritization. So the nurse is notified of the following client situation, and the nurse should first assess what? Again, you have four different patients, four different situations in front of you. See where you want to go first. So a client receiving ferrous sulfate who reports the constipation. Anything wrong into this? Like the person who is receiving ferrous sulfate, is that the constipation concern with this medication? Well, if you have a good knowledge, like you know, this is a common side effect, the constipation from this medication, then definitely this is not something which a medical emergency and you have to go there right away, right? But those students who do not have a knowledge about the ferrous sulfate, I highly, highly recommend if you want to remember only one thing about this medication, doesn't matter which exam you're writing down, just remember starting from today, ferrous sulfate, it's common side effect is the constipation, right? But this is not a medical emergency, so I'm not going to go with this situation first, being as a nurse, as an RN, if you're the RN in this situation. Now, the second one you have is a client with a migraine headache who reports the nausea and vomiting. Again, ask yourself, nausea, vomiting, is it common in the headache or no? If you think it's a yes, it's common. Again, this is not a medical emergency for you. Now, some students I know they start doing overthinking about it, like vomiting, they might gonna think like, oh, what about dehydration, too much vomiting there, right? Well, the question doesn't say too much vomiting, so I'm not gonna say it's too much vomiting as well, because it's only say vomiting, right? So nausea and vomiting, right? Definitely this is also the common, this is expected, a part of the manifestation of the migraine. So I'm not concerned about that at this point, but definitely will go later on after you deal with the medical emergencies, and definitely follow up with your both clients, number one and number two also, even this is common and this is expected, right? Now, moving on to the option number three. The three says a client with the herniated disc who reports shooting pain down their left leg. Ask yourself, if someone has a disc problem, do they feel pain down the leg, right? If you think it's yes, they can feel the pain like due to the increased pressure on the spinal nerves, like with mainly sciatic nerve, I would say, which is involved in there. That's why it's like a shooting pain in there. If you think it's common, again, definitely this is not a medical emergency. You have to go there right away, but definitely you need to go back to this patient at some point to do the further assessments, right? So for example, I'll do the neurovascular assessment maybe when I come back after dealing with my medical emergency, if I have it in case, right? So for right now, if you don't know if this is something you want to go there right away or not, maybe just compare it. So between 3 and 4, the 4 patient is a client receiving IV furosemide, which is your loop diuretic, right? and the patient reports tinnitus and decreased hearing, right? Do you think it indicates the ototoxicity? Because this is what it sounds like to me. Like it sounds like a ototoxicity. And if someone receiving furosemide, which is your loop diuretic, and the ototoxicity is there, do you think this is something a concern for you? You want to go there right away, or that can still wait, right? I would immediately go in there and check it out because it sounds like to me the medication has been administered rapidly, because usually when we administer rapidly, or maybe let's say in the large doses as compared to what is requested by the physician, right? Then at that time ototoxicity can happen, right? So this is this can impact the client hearing a lot. So I think I need to go there right away because permanent hearing loss can be there. So between 3 and 4, I'll pick the answer number 4, and then after that go to my patient number 3. Just do some neurovascular assessment, give some pain medication if needed. Then I'll go to patient number 2, and then I'll go to the patient number 1 after that, right? So I hope everyone understand this question. I'm watching your messages at the same time, right? So it's easy for me to know if you guys are learning or not at the same time. So feel free to participate. Doesn't matter where you're joining guys me right now, right? And even if sometimes someone watched this video after, let's say they missed the live lecture and they're watching this video after, try your best to type the messages in the comment sections. Usually these lectures become as a recorded on the YouTube. You can always watch them later on as well. And yes, after finishing the class today, I will also share this questionnaire PDF file as well. But that will be shared in the WhatsApp group. If someone is not in my WhatsApp group watching this video, feel free to connect with me so you can get the access of this file later on. You can print these questions and you can use these questions back again for yourself, right? Now, moving on to the next question quickly. The next question we have is the nurse on the inpatient psychiatric unit has been made aware of the following client situation. Again, it will be priority for the nurse to follow up with which client in here. Again, first, which patient you want to assess first, right? So the number 1 we have here is schizophrenia, who is sitting in a day room, staring blankly, responding minimally to the question. Is that the medical emergency, or you think it's an expected finding, the symptom of the schizophrenia? Well, I would say this is the expected symptom because it sounds like it's a negative symptoms of the schizophrenia. Those who really want to recall what is negative symptoms of schizophrenia and the positive symptoms of schizophrenia, I highly recommend to watch my the previous classes on mental health. I already covered this portion in there, but this is, I want to let you know, this is the expected finding. So I'm not really concerned at this point. So this person can wait. Now, if I go and compare with number 2, the bipolar disorder who is talking loudly, okay, and making plans to start a business without any prior experience. Is that the medical emergency? Like starting a business, thinking about it and just talking loudly? Or you think it's loudly, it's common with them, making an unrealistic plan sometimes, right? I would say this is an indication of mania phase, right? This is not an immediate the risk of harm, to self or maybe to others right now in this point. So I'm not gonna go there right away. Now you compare between 3 option, right? The third one says OCD client who has been at the sink washing the hands for past 5 minutes. Again, this is common expected ritual because they do feel the compulsion to do that from the obsessions what they have. So this is not something I need to go there and look into right away. That can wait. Now, the number 4 says PTSD client experiencing a flashback and displaying the signs of anxiety, hypervigilance, and disorientation. Ask yourself, you might be thinking flashback could be common in here, but ask yourself also at the same time signs of anxiety, and the patient is already hyper at this time and already disoriented, right? What's going on in here, right? Is this something normal with the PTSD, or do you think something going on right now, right? So I would say I need to think about the safety here for sure for this client. Because for me, the flashback definitely causes the client, to lose the touch with the reality. But when I see anxious and disoriented, that increase the risk of the unsafe behavior. Maybe self-harm, we don't know, right? That could be happen with this behavior. So I think it's a great idea. We don't have any other medical emergencies in here between 1, 2, and 3. So why not to go to the number 4 first quickly and see what's going on in there? Because I need to make sure I maintain the safety quickly for this client and engage with this client, in such a way that I can help reestablish a connection to reality. Maybe I'll ask the individual to do some deep breathing exercises if possible, right? It depends upon the situation at that time, but I want to think about safety first is in here. So my right answer for this question will be number 4. Again, I hope everyone is still learning out is in here. I can see students are sending messages, risk for suicide or harm. Very good, very good. Yeah, seems like you guys understanding this question. Moving on to the next question pretty quickly. Again, it's a prioritization question, back again, right? And here, it will be priority for the nurse to follow up with what? Again, it's a prioritization question, right? So in this one, the first says, if you see, they give you the age of the client. So I'm not going to look into that first until unless I really need them, right? Age factor usually not matter when you look in the prioritization, right? Now, what's happening with the number 1? The number 1 has osteomyelitis, who has a fever, reports swelling and pain to the affected side. Is that expected or is that not expected? I would say this is expected, right? You see itis, infection, right? And then you think about fever, swelling, pain in there, definitely. This is expected. These are the clinical manifestation of this diagnosis, so that can wait. This is not a immediately life-threatening thing right now. The second one you have is the cystic fibrosis who has a wheezing on the auscultation. And the pulse oximetry reading, they already give you 94%. Nothing happening right now, right? That thing can wait, right? The wheezing sounds definitely with which we have in here that can increase the risk for respiratory complications further, but it's not a compromising airway right now. They already give you 94%. So I'm not concerned about that. So that can wait. Now moving on to number 3, the 3 says it's a diabetic ketoacidosis client, so the DKA, who is receiving the IV fluids and the insulin. Okay, this person receiving 2 of them, who reports what? Throbbing headache. Ask yourself, why throbbing headache, right? When receiving 2 meds together and it's a DKA client, something happening right now? This is something you want to ask yourself. To me, it sounds like administering these medications may be too fast, too quickly right now, especially the IV fluids, right? Because when it says the throbbing headache, I want to think about the risk for cerebral edema at that time, right? Because when we rapidly infuse the fluids, that can enter the brain cells easily and increase the risk for cerebral edema. So you want to look for signs of increased ICP here because client already says headache, right? So this is my priority at this point because I don't want the brain to get further herniated and death after that. So hold on to this point. And then moving on to number 4, otitis media, who has yellow drainage, yellow ear drainage, okay, and suddenly shakes her head repeatedly while crying. Okay, what's going on in here, right? So this is like a middle ear infection, right? Ear discomfort is there. I can see. That's why the pulling the head is the sinus is in there. or maybe shaking the head, you can say, crying, pretty much normal, expected. Yellowish drainage, obviously, that is also because of the inflammation and infection which we have in there. So that makes the ear discomfort further. But this is not medical emergency as compared to number 3 right now, because 4 can wait, right? For the vital signs, airway, breathing, circulation is not going to compromise right away. So I would suggest to go to the number 3 in this case as the final answer. After that, you can go to number 4, right? And then you can just go to number 6. See if you want to give any pain medication, you want to recheck the fever. And then you go for number 8 after that. Sorry, number 2 after that, which is 8-year-old client. So this is how you want to think as a nurse for your prioritization. Some students, not some students, I would say majority of the students, they ask me this question when they call me, when they're studying for the NCLEX. They always says, we are making question wrong. Most of the time, our scores are reduced, when they are practicing the softwares online. So this is an example for them, how to analyze your questions. So not just look at the right answer, number 3, let's say in this case. You also want to think, like in the exam, if you don't get the option number 3, then where would you go next, right? So analyze properly, like after 3, which patient will come next, and then which one you want to go next, and which one you want to go next. This will help you guys a lot in building up the critical thinking skills. And believe me, it will help a lot in boosting up your scores after that, and definitely for the examinations too. Now, moving on to the next question quickly. Yeah, give me 1 second, guys. Okay, I need to leave the room for a few minutes. I'll be back in here, okay? Thank you. Okay, I'm back now, everyone. Some students were wondering where she left. So, yeah, usually I do this announcement in the beginning of the class. If I leave the room, just understand that part. But yeah, but some students I know, they just joined my class. So, morning and good evening to them as well, whoever that's just joined. Let me see some questions is in here. Thanks so much, Farzana. I hope you guys like that ECG lecture too. I actually had that one already with me, so I thought to upload it just in case if maybe that can be helpful for someone, right? I know students are also asking me, ma'am, can you make ECG in Hindi also? Like, I will make in English, that is for sure, but in Hindi, I will try my best, right? Because majority of the students, I think, already know this part. I try my best to take, some time out from my schedules every day. And if I can do the free classes initiative, every time on the Zoom like this with all of you, so we all can study together. But yeah, I don't want to say no. Maybe in future, right? I'll try my best as much as I can, right? Now, let's see if any other doubts is in here. Yes, Manpreet, I'll upload the two also later on as well. Thanks for reminding me with this message. And moving on to the next question, everyone. Sorry, I have to do two jobs at this time. Look after the little one and then do the questions, being online as an instructor at the same time. So understand that part for sure. Now, this question, without wasting the time, everyone, right? So in this question, it's again a prioritization question if you see, right? And you're caring basically here on medical surgical flow right now. And after reviewing the lab results, which of the following clients should the nurse see first, right? Again, you have a four different patients with you, right? And you want to see where you want to go first. So now the first one I have here is elevated WBC with an order of IV ampicillin, right? Well, if you already know that indicate infection and ampicillin, if you already know this is the antibiotic is already initiated, like not initiated, sorry, the order is there for sure, right? So maybe hold on first. If you're not quite sure, should I go and start the antibiotic first quickly because of the infection, right? So hold on, maybe, right? And compare with the next options. The second one we have is the low magnesium level with the order for magnesium IV piggyback. Okay. Again, it's an order. Oh, I can see all four actually the orders. Okay, now I got the clue where to go, right? So basically they want me to know, they want me to check and see which order I want to maybe initiate it first for them. So the first one is related to antibiotics, and the second one you got related to the magnesium, right? Well, magnesium definitely responsible for the heart muscle contractions and the neuromuscular transmissions too. And if there is a low magnesium level, that can lead the cardiac dysrhythmia also. But between one and two, I'll maybe pick number two at this point, just thinking about dysrhythmia, right? And I'll leave the option number one at this point because I don't know how much WBC high at this time. Is there any fever right now or not? Like, I don't have any clue in the background in picture. So right now between one and two, I'll maybe just hold on for number two. Now you go between two and three. Those students who pick maybe one, maybe hold on between, now you compare between one and three. So the three says elevated serum glucose, the blood glucose with an order for the sliding scale insulin. Again, it doesn't really say that, like how much is the sugar high right now, right? And ask yourself with the high hyperglycemia, do you think someone can die faster, right? If you don't go there and start the insulin quickly, right? This is how you want to think about it. So I'll still pick the number two in this case. Well, definitely insulin administration is also important at this point, but I don't know about the blood sugar in here yet. I don't have the other background information. So I don't know if that person is sick, damn sick. I have to go there right away. So I'll just maybe pick number 2 at this point. So between 2 and 4 for me, the 4 says respiratory panel, and it's a positive for influenza. You want to think about droplet precaution here now, right? And it has an order to initiate the isolation. Oh, okay. Now, which one you guys think you want to go first? Now, in the prioritization, there is also like a rule, which I want to tell you guys. You want to do maybe that task first. So this is like a task related. I can see the 4 different tasks in front of me. Now, when it's the task related, you want to maybe pick that task first, which is very, very important, and that will take less time to do it, right? And then after that, you can go to the other one. Something which takes a lot of time, I want to do at the end, right? Because that will take a lot of time, and by the time my other patients will be compromised, right? Until unless is that not maybe the emergency. So for me, I'll go to patient number 4 first because I want to think about the infection in here, the spread of the infection. So I want to, think about the droplet precaution here, right? So do quickly maybe isolation here immediately so you can prevent the staff and you can also prevent the other clients on the floor. And then after that, you can go to the other clients. For me, I'll go to 4, then I'll go to number 2, right? Then between 1 and 3, I'll just go to number 3, then I'll go to number 1 at the end, right? Because it's already elevated WBC in there, already infection is in there. Um, well, definitely that can wait next couple of minutes, 15, 20 minutes will not take too long to go and start the ampicillin, right? So, but yeah, insulin will be way, way faster to give it, as compared to the doing an IV line for the antibiotics. So I'll go to 4, 2, 3, and 1 in this sequence. So the final answer for this question is number 4. Again, why I'm telling the sequence, just in case you don't get the same option, you got the different options in your real exam, then it will help you to understand where to go first and after, right? Now, moving on to the next question pretty quickly. The next question we have is, the nurse has been made aware of the following clients, and the nurse should first assess again who, right? So think about the prioritization back again. So the first patient I have here is 28 weeks pregnant with a sharp pain in the left lower abdomen and the groin while standing. Okay, it's 28 weeks and it's a sharp pain on the left side of lower abdomen and it's a groin. What does it indicates to you, right? Ask yourself, seems like this is to me sounds like a ligament related pain. Usually it's a ligament pain when the uterus is basically grows out. So while standing, feeling that sharp pain in there, I'm not concerned about that. For me, this is a normal discomfort of the pregnancy. So this is not in my list for sure. That can wait. Now between 2, 3, and 4, the 2 says 48-year-old with the hypothyroidism. Okay, this is hypo. And they already give you taking the levothyroxine for that, but reporting fatigue, constipation, and the paresthesis, right? Ask yourself, do you think that's the really, really bad symptom? You want to go there right away, or that can wait, right? Well, to me, it seems like the treatment may be not effective really and maybe require the medication adjustment, but this is not something like a medical urgency for me. I have to go there right away. That with the constipation, fatigue, and paresthesis is going to be dying quickly, right? So for me, this thing can wait. So again, this is not in my list at this point. Now between 3 and 4, the 60-year-old who suddenly stopped taking sertraline. Ask yourself, right? Suddenly stop taking this medication. Now recall your sertraline. I'll give you guys a clue. Mental health related medication, right? And then is experiencing nausea, insomnia, and irritability. Suddenly stopping a med and feeling this thing. Well, it is the the symptoms of the withdrawal, this is your SSRI medication, right? One of the classification of the antidepressants, right? When stopping this medication, this is the withdrawal symptoms for that, right? But ask yourself, nausea, insomnia, irritability, is that the medical emergency? Someone can die with the nausea, someone can die with the insomnia or irritability, right? If you're not sure, maybe compare it. You will find out the answer. The fourth one says 11-month-old vomiting for 24 hours with the nasal congestion and the fever. Oh, there is a fever, high fever. Now, where you want to go first? Who can die pretty quickly, right? For me, I want to go to number 4, right? Why I want to go to number 4? Because it's so much high fever and it's vomiting already been 24 hours. I want to think about dehydration actually in here, get the order and start something. I want to give some fluids, right? So for me, electrolyte imbalances is a major concern in here. So 3 can wait, but 4 cannot wait at this point. So I want to go to number 4, not just because of 11 months, but because of vomiting for 24 hours and there's a fever on the top, right? So I'll go to number 4 and then I'll go to number 3 after that. And then you can go to maybe probably number 2 next. 1 is pretty normal, right? So this is how you can think about this question as well. So the final answer for this question is number 4, right? Let me look into your messages too, just to make sure you guys are doing okay, learning so far. Okay, let's see here on the YouTube as well. YouTube students, try your best to participate in the chat boxes because I always look into the messages as well. Okay, now moving on to the next question pretty quickly. Again, this is prioritization, right? Because here they say you are caring for 4 clients on a pediatric floor where the lunch tray arrives. Now, which action should the nurse implement first at that time? Again, it's a priority. Prioritization is related to action. So which thing you want to do first, right? So in this question, the first one you have is the administer mealtime insulin Lispro to a client with a type 1. Lispro. Which one is Lispro? Is that like your fast acting? Is that your short acting? Or is that the long acting? Who want to tell me the answer? Let's see. Fast, regular, or long acting, rapid. Yeah, rapid is fast. Very good. This is a fast acting, rapid acting. Very good. So I want to hold on to this one because Trey already arrived there. And this is the fast acting. Within half an hour, the insulin can go in a peak time as well. So I really want to make sure I give this insulin along with the food, when the client just start eating the food at the same time, right? Now, moving on to the second one you have is the administer pancreatic enzyme replacement to the client with the cystic fibrosis. Okay. Is that can wait as compared to insulin? For me, it can wait. It's just the enzyme replacement I want to give it. Now between 1 and 3, initiate the schedule, start me to feeding, right? Well, feeding will take you some time to get started, do some assessment, and then start the feeding and stay with the patient as well. But insulin cannot wait because the food is already in there, right? So I want to still quickly go to number 1, then I'll think about the other clients after. Then number 4 says administer ondansetron to a client who's too nauseated. Well, again, that can wait. Oral medication, right? It's nauseated, I know, but already receiving the IV fluids at the same time, so that can wait. So I'll go to number 1, then I'll go to probably, then you 2 and 4 is probably same, and it will not take you too long. So doesn't matter you want to go to 2 and then 4 or 4 you want to. For me, I'll go to 2, then I'll go to 4 right away because it will not take too much time to administer this oral medication. And then I'll come back to number 3 after that, because it will take me some time to start the tube feeding in this client. So this is how I will go for this question. So the final answer for this question is number 1. Now, moving on to the next question quickly. The next one is, the nurse is caring for admitted clients involved in the mass casualty incident. Okay, the nurse must discharge a client to make the bed available for more injured client. You want to maybe discharge that client, in here, who you think that can be treated at home easily, and more stable. You want to maybe discharge that person. So think about more stable in here, right? That will take you clue to the answer right away. Someone who is more stable, right? So between 1, 2, and 3, 4, right? You can already see the 1 says contusion to the chest wall and heart rate is 110. I think still require further assessment at this point. Not a good idea to send to the home, because I need to still assess, for further complications like pneumothorax, maybe cardiac tamponade. So not an appropriate idea discharging at this time. The 2 says sewed around the nose and the mouth and the respiratory rate or still hyperventilation. I don't want to send this person again to the home, right? This person can still wait. We don't know if this person require probably the intubation. We have no idea, right? The third one we have is the headache and bruising behind the ear following the head injury, right? Well, again, it sounds like if it's a bruising behind the ear, I want to think about the fracture in here, right? Maybe it's a basilar skull fracture, right? We usually call this a battle sign. What does it say in here? So for me, CT scan may be probably required, and I don't think so it's a good idea to send it out to the home again. Almost same, 1, 2, and 3, right? And then the last one you have is superficial, and it's no bleeding abrasion, right? And it's just on the face and upper lips. Well, that can be treatable at home also, right? So I'll maybe discharge this person more stable right now. This person can go home and get the treatment required, like antibiotic creams, maybe cleansing just the wound, and that can stay at home and then follow up with the nurse, maybe over a phone call. Maybe someone can go to the home and check this client also. So the final answer for me is number 4, discharge this person so you can have the bed available for the next injured client, right? So again, I hope everybody liked this question so far. Moving on to the next questions quickly. The nurse has received the following report for the 4 clients in pediatric unit. Which client should the nurse assess first? Again, which one you want to check first? Again, they give me like an age. I'm not going to look at the age first. As you know me, in prioritization, I never look at the age first. Now, the first one you have is the one with the tibia fibula fracture due to the pain medication. Oh, due for the pain medication, sorry. Due for the pain medication. Well, that can wait. Pain never kills someone. If you guys know from my one of the previous classes, I always tell for the NCLEX, even after passing the NCLEX exam, when you start working in countries like USA, Canada, Australia, countries like, always remember when you're working as a triage nurse in a hospital, remember chest pain is the only concern, okay? Other than that, any other pain which is not affecting airway, breathing, and circulation, those type of pains can wait, right? So definitely this person can wait. Now, the second one you have is the diagnosed with the influenza. Okay, you want to think about maybe this is like a droplet in here, right? But what is the right now problem? Right now is fever. What's between 1 and 2? Maybe I'll pick number 2 for now. And then you go between 2 and 3, right? Fever is expected wasn't there. I forget to mention that earlier to you guys. Now, number 3 says post-tonsillectomy, right? And it says adenoidectomy with the complaint of the sore throat, right? Again, ask yourself, right? When someone already had a procedure done, after that having a sore throat, is that the medical emergency compromising airway, breathing, circulation right away, right? Or you think that can wait? For me, that can wait. Now you go between 2 and 4. So between 2 and 4, the fourth option you have is the 5-month-old with the RSV condition who already have right now what? Intercostal retraction. Oh, airway, right? So you want to think about the airway in here. So for me, the right answer is number 4 because it indicates it's a sign of the respiratory distress, right? So I really want to go into this right away. The poor oxygenation is in there and help this person right away. This person is not breathing enough. So for me, the right answer is number 4. Now, moving on to the next question quickly. The next question you have is the nurse has become aware of the following client situation. The nurse should first assess again who? Now, here the first one you have is a 1-day-old newborn, okay? But what is right now? Blue tinge to hands, feet, but why lips? This is what I'm concerned, right? You guys might know already, like hands and feet, acrocyanosis within 24 hours. You want to think about that. But why lips also involved? Now I want to think about central cyanosis actually, right? Hold on. Airway, right? And compare between next options. So the second one you have is the 32 weeks gestation, admit to using cocaine an hour ago. Well, this is already an hour ago took it. What is right now? That doesn't say anything in here yet, right? Still require the further assessments. Definitely it will cause the cocaine will cause further vasoconstrictions. It can decrease the placental blood supply, increase the risk for the placental abruption as well. But right now, they didn't say me anything right now. So I want to look into the number 1 quickly. Maybe I'll tell somebody to stay with the patient number 2 until I deal with the emergency number 1 because it's already compromising with the airway. Then you have between 1 and 3. The 3 says laboring client who is 39 weeks of gestation and the variable dilation. Variables are also bad if you remember that. But who is gonna die first right away if you don't go in there? So let me look into your chat messages between 1, 2, and 3 so far. Do you guys still want to keep the 1 or you have something else? Okay, I can see some students also pick number 4. Oh, is that you picking for this question? When you say number 4? Okay, that was the previous one. Okay, try for this one, everyone, right? For me, I still want to pick number 1 at this point. Number 2 and 3 can still wait. Well, they'll definitely maybe have someone, another nurse, go to number 2 and go to number 3 from your team, and they can just look after, right? Until I deal with the number 1 emergency. Then between 1 and 4, the 4 says 4 days post C-section. Fever is there, yellow wound drainage. Well, fever is again indicate infection, purulent discharge infection. I want to think about giving antibiotics here too, but it's not a medical, the something like immediately threatening emergency right away, which I have to look into. So for me, the answer is still number 1, right? And after that, I'll go to the other patients. Now, where you guys want to go maybe after number 1? Let's see here. For me, I want to go to probably number 3 next because it's already indicate the variable deceleration happening right now, right? And maybe have somebody still stay with the number 2 and they will be updating you in the meantime what kind of symptoms is in there, how the fetus look like as well, right? So I'll go to number 3 because it's already variable. Maybe call someone for help immediately, get the doctor. You guys want to think about probably C-section here quickly, right? And then after number 3, I'll quickly go probably number 2 as a next in a meantime, just to see how my patient is doing, what kind of symptom presenting so far still, right? If nothing much symptom still, then tell the person to wait and go back and give something, get the order for antibiotics, give all those things is in here, and then go back to number 2 back again, right? So this is how I want to think about the prioritization like this if I have 4 different medical emergencies in front of me. So I hope everyone learned something again good so far with me today, right? Moving on to the next question quickly, and I'm still checking your messages on YouTube and also on the other side as well. Yeah, no worries. Try your best to participate as much as you can. So the next question you have is the nurse is notified of the following client situation. The nurse should first assess who. Again, you got 4 different clients, right? Now, the first one you have with the influenza, but who has a fever 100.7. Well, expected, in this condition, having a fever, not like a priority at this point until unless maybe there is no emergency in the other option, then I can think about this person. So between 1 and 2, the 2 says admitted for pancreatitis who has the abdominal guarding with the palpation. Abdominal guarding with the palpation. Is that normal, not normal? What's happening in there? It's a pancreatitis patient. So for me, definitely the pancreatitis cause the severe abdominal pain, right? And the client who are usually with the pancreatitis, they often really usually guard their abdomen to avoid the painful palpation, you know. I would still continue to assess this client, the GI system and everything for the changes. But for me, it sounds like right now this can still wait. But if I have a no emergency, then maybe I'll come back to number 2, right? So between 1 and 2, let's maybe hold on to number 2 for now. And then you compare between 2 and 3. The 3 says a client admitted for the treatment of TB, which is tuberculosis, right? Who is reporting blood tinged sputum. Again, it's a common clinical manifestation, expected finding. So for me, I'm not concerned about that. And then you go between 2 and 4. The 4 says client admitted following the traumatic crush injury who has a dark brown urine. Why dark brown urine after the crush injury, Why dark brown urine, right? Does it indicate something, right? A bad sign maybe? So for me, I think I want to think about kidneys here, right? I want to think about the rhabdomyolysis. I don't know, maybe if that's the one as a question mark, maybe in here to my brain as a nurse. Because rhabdomyolysis is what? Rhabdomyolysis is a emergency condition that usually occur, when someone get the trauma, and that causes the damaging muscles, and they release further myoglobin into the blood, right? So this color, I'm thinking about rhabdomyolysis because the myoglobin buildups in kidneys and it can further do the acute kidney injury as well. So if it's already indicated this color, I want to think about kidneys as a next, right? Like kidneys already injured, already acute kidney injuries there or what, right? After this condition. So for me, I want to go to number 4 first. This can wait totally, right? Then I'll go to number 2 as a next, see what's going on in there, right? How the person is feeling. And then I'll go to number 1. 3 will be very last for me at this point. But the 4 is number 1 emergency for me because I want to think about the acute kidney injury here when I see this color in the back. So I hope everyone understand this question back again with me. I'm still watching your messages right now. Let's see here. Yeah, internal bleeding. Very good. Yeah. Okay. YouTube students, any doubts for me so far? No, I don't see any doubts yet. Okay, good. Seems like everybody's learning. Now, moving on to the next question quickly. The ICU nurse has been made aware of the following client situation, and the nurse should first assess the client with what? Again, you guys have 4 different situations in front of you, right? Now, a traumatic brain injury and missed the most recent dose of the levocetirizine. And then the second one you have is the sepsis, who has a critical lab value indicating the elevated WBC. Okay, so between 1 and 2, what's going on in there, right? When I see the first option, which says traumatic brain injury, right, and miss the dosage of that, well, definitely I want to give this medication to reduce the risk of seizures, but it's not something I want to go there and give this medication right away because right now I don't really see seizures or anything right now, so that can wait, right? And then the second one you have is a sepsis who has a critical lab value indicated the elevated WBC. Well, I want to think about definitely, infection in here. So between number 1 and 2, I want to hold on number 2. Now you go between 2 and 3, right? The 2 and 3, the 3 says CHF client who has a frothy pink tint sputum and crackles also upon the auscultation. What's going on? Does that indicate congestive heart failure now is there? Okay, they already give you this is congestive heart failure. Okay, but what does it indicates when you see these symptoms? Sounds like pulmonary edema maybe? Yeah, very good. It seems like complications start getting further now, right? And pulmonary edema, when it's there, you want to think about the respiratory failure now, right? So should we go to the number 3 first? And the 2 can wait, right? Now you go between 3 and 4. The 4 says pneumothorax, who has the intermittent bubbling in the water seal chamber, right? Those who don't know this part, so this is like your knowledge part, just so you know the content related, right? So this is expected, right? Those who are really bad in remembering the chest tubes kind of things, let me tell you, we're gonna cover for sure. And one day I remember somebody asked me about the ventilator also. Definitely will cover that as well. Give me some time. Probably I'll try my best to do it soon because I still need to do your fluids and electrolytes and bring out some ECG lectures in English also. And then after that, I'll try to see if I can maybe do the endocrine maybe first quickly, because endocrine for right now, I just give you guys roughly, but I still need to cover up more in details on the endocrines a lot. So maybe endocrine, maybe after that, and after endocrine, we can go back to the respiratory system, right? Again, I'll just try my best as much as I can, right? The only thing, as I always tell everyone, like it's just during my class, I have to go running back sometimes. So just bear with me, but I'll try my best to make more sessions continuous wherever I can, right? So we guys can study more together. Now, moving on to the next question quickly. The right answer was 3 for this question, right? Now, moving on to the next question. The next question says the nurse has become aware of the following client situation, and the nurse should first assess the client who in here, right? So for this question, the first one option you have, which is 37-week pregnant who is in labor and leaking the green amniotic fluid. If you're not quite sure that's a medical emergency, maybe compare with number 2. Now, when you compare with number 2, it says placenta previa, experiencing scan bright red vaginal bleeding. So placenta previa experiencing this, that is probably because the placenta implants in the lower uterine segment in there. Yeah, these positions, I would say they usually leads to painless, bright red vaginal bleeding. So I'm not really concerned about that. This is not the emergency for me. Still go between 1 and 3. Now between 1 and 3. The 3 says 38 weeks pregnant client with a uterine contractions every 3 minutes. Okay. And pink tinged vaginal discharge, right? That's just because the bloody show could be there, right? But every 3 minutes, not every 2 minute, 1 minute yet. So that can still wait, right? But maybe between 1 and 3, I'll hold number 3 for now, right? Until I compare with number 4. The 4 one says, the postpartum client who delivered actually 12 hours ago. Okay, but what's the problem right now? The right now actually has a headache and the blood pressure is 160 by 90. You guys want to maybe think about the hypertension here, right? Because if it says postpartum, the blood pressure is high, which is 160 by 90 here, and the headache at the same time, sounds like hypertensive disorders of pregnancy, which happen actually after this. And usually the pre-eclampsia and eclampsia, they usually happen earlier. And then after, the client, when deliver the baby, when someone have the headache and high blood pressure still, then I think I need to look after antihypertensive medication first. So if preeclampsia is diagnosed maybe before than that, just in case for this client, probably they're going to give magnesium sulfate just for the prophylactic seizure prevention. But right now, I want to go to number 4 first because I don't really see any other emergency right now. So for me, the right answer is number 4. Let me see if there is any doubts, any questions so far for me in here. Maybe someone is confused in something, so I can help you guys, please. Okay, let's see here. Okay, perfect. I don't really see any doubts yet. On YouTube, no doubts so far for me. You guys still learning so far? Okay, perfect. Now, moving on to the next question quickly. This one. Again, it's a prioritization. See, the more you do prioritization together with me today, you're going to be master into that actually. And I don't think so after this classes, you guys going to make a lot of prioritization mistakes, right? Now, moving on to this question. The nurse has been made aware of the following client situation. Which of the following client needs should receive the highest priority? Means who comes first again, right? So the first one I have here is the administer the antibiotic for cellulitis due an hour ago. Okay, already an hour. Something not affecting right away right now, right? I think this person can still wait. Obviously, risk for the high infection and everything is in there. So I want to try to administer as soon as possible. So if you're not sure, maybe hold on for now and compare with number 2. The 2 says, assess the client who report the redness and pain at the incision site. Well, redness and pain at the surgical incision, possibly again infection, right? I really want to go and assess this one first, maybe do some antibiotics, labs, so between 1 and 2, I want to go to 1 quickly because it's already due, right? And then I'll come back quickly for the testing in here, get the antibiotics order also, right? So almost same for me. So I'll keep the number 1 for now. Then you compare between 1 and 3. So between 1 and 3, the 3 says, assign the assistive personnel to stay with the client who's reporting suicidal ideation. Oh, now who is the more highest, priority for you right now, where you want to go first by yourself? Oh, I think I should go to this person now. The rest, everybody can wait on the floor now, right? So for me, I'll pick number 3 first. Now compare between 3 and 4. I can already see the 4 is not the right answer because it says provide education, teaching something, and that can wait, They're already requesting a paperwork for 2 hours, so something that can wait, right? So 3, I want to go there first quickly. And I want to show you guys one more thing in here, in this one, another strategy. If you guys look very carefully with me, maybe it can help you eliminating some of the times answer in some questions. Now, these 2 options, if you look very carefully, They both are infection related, right? When you have single type of question, you only have to pick single answer, not a select all that apply type of question. In that case, when you have to pick only one answer, none of them cannot be the answer because either they both are in, either they both are out because they both are infection related, right? And that means probably in the NCLEX, when you're doing these questions, you will have something else more priority than this. When two options are same, none of them is the right answer. When it's a single type of question, they only want a single answer. Why? Because if I go to patient number one, why not number two? If I go to number two, then why not number one, right? Because they both are related to infections, right? Both needs a medication in here, right? So this is something I want to show you guys another style or trick or something to do the questions, just in case maybe it can helpful for you doing some question next time, eliminating quickly some options together. So right answer for this question was number 3. Now moving on to the next question quickly. The next question you have is the nurse is informed about the following client situation. The nurse should first assess the client who again, right? The first one you have is the obtunded hospice care and become restless. The client actually who is obtunded and receiving the hospice care, right, seems like near the end of the life, right? Well, because it's restless due to pain, anxiety, or maybe no oxygen or less oxygen right now, could be like imminent death. So if you're not quite sure you want to go there first right away because someone is dying, right? Hold on and compare it, right? It's already hospice care, right? So you want to think about that too. And then compare between 1 and 2. The 2 says, had a cholecystectomy 2 hours ago and reporting the nausea. Reporting nausea after a surgery, that is normal. This is not going to die. Now you go between 1 and 3. The 3 says peptic ulcer, okay, but why rigid abdomen? Why reporting sharp abdominal pain? Why? What's going on in there? One person is already dying and it's already on hospice care. Do you still want to go and just wait there at the bedside? Or should I go and deal with the medical emergency until then and come back to the number 1 later? You can have someone else, stay with the number 1 because it's already expected, right? So for me, I want to go to the emergency type of things first, right? So I want to go to number 3 first. Why? Because for me, it's indicate the peritonitis actually, right? And peritonitis is a life-threatening medical emergency if I don't go there, right? It's already indicate the perforated ulcer, right? So I want to go into number 3 first, right? And have someone maybe for number 1 that can wait. By the time you deal with the medical emergency, then go back to number 1. See how's everything going on in there. The patient is still there or not, right? And even also, your number 1 LPN can also deal with it at the same time. She can help you, she or he can help you, LPN on the floor with the medication, whatever required to give in the last minute, right? So now between 1 and 3, I'll keep number 3. And then you compare between 3 and 4. The 4 says abdominal surgery 2 days prior and reports the left lower extremity pain and swallowing. It's a 2 days prior, left lower extremity pain and swallowing. Well, that could also indicate the DVT, right? But do you think if the DVT is suspected, do you think the pulmonary embolism happened right away? Is that something you want to go there quickly? And 3 can wait for you? No, 3 already indicate the signs of peritonitis. So I want to go to number 3 first. And now I want to go to number 4, being as an RN, right? You have another nurse, LPN, or someone else, stay with the number 1 until that time, right? Until you guys dealing with the emergency, right? So after 3, I'll go to number 4. Then I'll come back to the number 1 after, right? The one who is reporting nausea, I can have my LPN. When you are busy on the floor like this with the prioritization, you can have someone else go in there and administer the medication in the meantime. But in this question by yourself, where you want to go first as an RN. So as an RN, I think I want to go to the number 3. Now, let me look into the screens also. Seems like some questions are coming. What means DVT? It's a deep vein thrombosis. This is I discussed in the cardiac lecture. If you guys want to go back to my cardiac lecture in there, it's basically the medical emergency. If you don't look into that, warm, redness, decreased pulse in the affected extremity, those signs really give you a kind of clue if it's suspected. And further pulmonary embolism can be happen too. So this is a brief information for you, Daces. Let's see here. Yeah, no worries. Yeah, maybe read about DVT tonight, Daces, if you want to go back to your Saunders book. It's given in your cardiac chapter. And if you still do not understand, you let me know. You can always give me a quick message or call, and I'll explain you over the phone, right? Quickly, this topic too. More in detail, like what you can do as a nurse, what symptoms you want to check in there too, right? Even some other students, sometimes you don't understand any topic, you can always send me a message or call. So I think everybody good so far. I don't see any other doubts, anything in here. Let's see here. No, I don't really see any questions so far yet. The person on the YouTube who is asking me, ma'am, placenta previous first priority or not? I don't know which question was you were asking this comment, my dear. I just saw your message, sorry. Maybe after the class, if you want to take a screenshot of the question, the one where you got stuck in the placenta previa type, send it to me and give me a message or call. Okay, so I'll explain it to you if it's emergency or not in that case, and if not, why, if yes, why. Because I don't really recall right now which question was that. Okay, I just checked your message now, that one, so I thought to tell you this thing. Okay, let's do another question. And let's see here. We still have a more questions to go in here. Okay. So the home health nurse is preparing to visit the 4 clients who actually live near each other. The nurse should first visit the client with what? Again, it's a prioritization, right? The first one you have is the diabetes, who is reporting shooting leg pain after a below the knee amputation. Okay, neuropathic pain, right? Is that like something can wait, something cannot wait? I would say this can wait, right? After the amputation, expected. So I'm not gonna go with that first. So this can totally wait. The second one is chronic bronchitis, who is reporting copious amount of tan, blood tinged sputum. Okay. Copious amount, blood tinged sputum. Sounds like COPD, right? Um, that can wait. This is not something affecting with the airway, breathing, and circulation right away. Well, of course, it's indicate the chronic inflammation, everything in there. But if you're not sure, maybe compare with number three, sorry, right? The 3 says cancer who had the chemotherapy last week, but why fever right now when chemo has a last week, right? Now between 2 and 3, I want to pick number 3 because I want to see here it's a sign of infection or sepsis definitely, right? As you guys know, the chemotherapy can cause the bone marrow suppression, which reduces the amount of those available neutrophils or blood cells, maybe platelets, right? Now, usually the suppression is more severe And these neutrophil counts, they are usually lowest, I would say mostly commonly between 7 to 10 days of the beginning of the treatment. But we should report any fever, when someone is going on with the chemo, because that can indicate life-threatening emergency or the sepsis. So for me, I want to pick number 3 for now rather than number 2. And then you compare between 3 and 4. The 4 says a bulk drain after a cholecystectomy that had the output of 50 ml yesterday and 30 ml today. Okay, it has been reduced, right? Sounds like a moderate amount of drainage was there like before, and even like today, the drainage amount is still there. It's not like saying 0 or 100 ml, so much right now that I'm concerned about it. Why too low or why too high, right? A little bit difference is in there, right? I think I need to notify here, especially the doctor, about the declining of the output. Maybe we want to discontinue the drainage, right? Because secretion, the drainage is coming less now, right? But this is not a priority for me. I have to call the doctor right away, get the, give the recommendation to the doctor, get the tube out, right? So for me, this can wait, still 30 ml is coming, right? So for me, number 3 comes first, right? And then after that, I can go to the number 4. Then I'll go to this chronic one, and this is expected, definitely. Even if you go there first, this is still expected, right? So for me, 3 will come first as a final answer. So I hope everyone is still learning so far. You guys understand how I did this question, and I'm not making you draining out so far yet, right? Moving on to the next question quickly. The nurse on the child and adolescent inpatient psychiatric unit has been made aware of the following client situation. Again, it will be priority for the nurse to follow up with the client with these conditions. Again, it's a prioritization. Try your best to do this question before I tell you the right answer as well, right? And in this question, the first one is social anxiety disorder who is refusing to attend the group therapy session. Again, it's not the emergency. I think we did this question earlier, no? To me, it sounds like we did it. I don't know. Make me correct if I'm wrong. The second one says conduct the disorder who hits the table while starting to argue with another client. Between 1 and 2, I want to think about number 2 because already hitting the table, already arguing with someone, you know, I want to think about the safety risk here. So hold on to number 2. And then you go between 2 and 3. The 3 says oppositional defiant disorder who is refusing to make his bed before the breakfast. Well, that's not a medical emergency right away. Someone is not making the bed. Okay. Now you go between 2 and 4, right? So 2 and 4, between 2 and 4. Then you have the ADHD client here who is having difficulty organizing the homework assignments. Again, this is expected. Common in the ADHD client having all these challenges. So you're going to provide the support for sure. But if you already have the risk for self or risk to the others, it's a safety risk. You want to think about maybe this one first, right? So you want to think about the violence here. So the 2 is the right answer for this question. Now, moving on to the next question quickly. The nurse has been made aware of the following client situation. The nurse should first assess the client who is what? 7-year-old with the 102 fever, experiencing a cough and malaise. Okay, if you're not quite sure, hold on and compare between 1 and 2. The 2 says it's a pregnant lady with the hard, painful abdomen, small amount of dark red vaginal bleeding. I think I want to think about placenta abruptio in here, right? In number 2, right? Now you want to think about placenta abruptio, or do you think we should think about the high fever with the cough and with the malaise, right? Because when I see the cough, fever, and malaise, sounds like an upper respiratory infection to me, right? Um, but is that the medical emergency come first right away with it can affect the airway, or do you think the number two will come first? For me, I want to go to placenta previa first because fetal distress can be happen, hypovolemic shock, the risk for hypovolemic shock, even also for the mother to go. So I want to think about number two first. Now you go between two and three. The three says 76-year-old with a heart failure, 2 plus pitting edema, and then you have the experiencing shortness of breath. But hold on, experiencing shortness of breath on exertion time, not all the time, right? So on exertion only, basically. They already tell you why shortness of breath. So ask yourself, when someone is doing some exertional type of work, like heart failure patients, is that expected, feeling shortness of breath at that time, or is that not expected, right? So that is something, a symptom of heart failure, obviously. So this is expected. This is not something affecting priority right away. You already have the obstetric emergency first is in here. So I want to go to number two. So now you go between two and four. 31-year-old client experiencing nausea, vomiting, restless. Okay, three things together. Who has been out of the hydrocodone. Oh, it's just because of the person did not have the hydrocodone, right? So this is like a opioid withdrawal symptoms I can see here. That can wait. This is expected when someone doesn't take for 2 days, right? So for me, the final answer is number two for this question. Moving on to the next question quickly. The nurse received the report on the 4 assigned clients. Now, which clients should the nurse assess first, right? Now, here you have the about 4 different clients again in front of you, right? The first one, it says 1-year-old with a group who has a continuous loud barking cough. Okay, what does it indicate to you? Group. Okay, it's already group. This is in here. Okay, well, it's expected then. This is not something I want to look into right away. Well, if it says me, signs of distress, then I can see it, but this is expected, right? So for me, this is not the right answer. The second one, you have 16-year-old client with a sickle cell disease who is having difficulty in speaking also. Difficulty in speaking with a sickle cell disease? Why? Why is it like that? Does it indicate something happen, as a part of complication from sickle cell, or what's going on in here? I want to think about actually why difficulty in speaking. Let me tell you, this is actually, the complication stroke. Yeah, I want to think about stroke actually. Could be a stroke, right? We don't know if it's a stroke already happened there because in sickle cell disease is actually causes normally those, the round erythrocytes to morph into sickle shape. Now, sickle cell blood cells, which is your RBCs, when they clump together, they forming clot, they can actually impede the blood flow, causing vaso-occlusion, and they can also potentially do ischemia, which is stroke, and even the organ failure also. So I want to think about in here, what's going on, maybe stroke, right? So hold on. Number 3 says 7-month-old with a respiratory RSV who is lethargic actually and has a temperature of C101. Again, this is the expected, right? Finding. So I'm not concerned about this thing in RSV because it's an expected symptom. The 4 says the 10-year-old client who's 1 day post-op tonsillectomy reports, my throat hurts so bad so that it is so hard to swallow. Well, again, this is like tonsillectomy surgery done, so a painful throat is expected after that, right? So I'm not concerned about, definitely it needs to follow up in there, but it's not the medical emergency right away. If I already have number 2, someone is already going further into the stroke, you know. I want to think about this person first. So 2 is my right answer for this question. Now, I think we're probably gonna done until here today, guys. Very last lecture will come tomorrow in continuation of this, because I can see still probably 15-20 questions more left to do it. So which is a good idea to do in continuation tomorrow rather than today. We don't want to make you guys tired at the same time, make your brains working effectively at the same time, even for myself too, right? It's already 11 o'clock in my local time in the nighttime here. I can see for some students 1 o'clock, even they're attending the class right now, 1 a.m. And yeah, so maybe we can done until here today, everyone. The right answer is number 2 for this question. Now, maybe I'll see if anyone has any doubts, any question for me before I leave. And tomorrow we'll bring the class probably around the same time, but I'll send you guys announcements ahead of time in the WhatsApp group. If any doubts, any questions until here for me that I can address before I leave, and we'll continue the last part of this master class tomorrow. Any doubts, any questions until here? And those who have not joined my WhatsApp group yet, I highly recommend to join, because I'm going to share this document, the question document, probably tonight or tomorrow, maybe tomorrow after we've done all the questions, right? And you guys can have then print out of these questions as well if you like it. Yeah. So I would say if no doubts, no question, if everybody is good, I just want to say thanks so much for joining today. And I'll see you guys back again tomorrow for the next session, continuing with this one. Yeah, no worries. Thank you so much, everyone. Yeah.